last video, I was telling us on tips to stay healthy. I talked about rest. I talked about quality sleep under rest. I talked about exercise. I talked about smoking cessation, cutting down on alcohol. Actually, alcohol recommendation is about 14 to 15 units in a week. So that's like 3 units a day for maximum 5 times in a week. So if you're taking alcohol every day and you're not having skip days, then you should actually know you're taking excess alcohol. Okay, if you're beginning to get addicted and dependent on alcohol, then that's way too much. You should make frantic efforts to cut down on your alcohol consumption. I also talked about use of recreational drugs, which is very harmful to our health. I talked about that. So today, I want to be looking at diet. Diet. So a lot of people, because of busy lifestyles, busy schedules, a lot of people find it difficult to prepare their own food at home. And you see people resorting to junks and a lot of fast foods. Even as a family, some family eat out morning, afternoon, and evening. Yeah, I'm not here to judge anybody. I'm not here to tell you how to run your home, but I'm just here to tell you that it's better you prepare your own meals. It's healthier when you are the one mixing those ingredients by yourself, so that you know which one is in excess, you know which one is healthy enough for your family. And because when you buy food from outside, it's difficult for you to say what has been used to prepare those very delicious, yummy, and sumptuous meals that we get from outside. Yet I know that sometimes is just difficult to go without them, but when those days come, then you can adjust accordingly. But make it a habit to prepare your own food in your home, okay, so that you're sure of the ingredients that you have in there. The next thing I want to talk about is regular checkups. Regular checkups. Sometimes people come into the clinic for checkups, and that is the first time both the patient and the doctor will be aware that this patient is having one form of chronic illness that has developed or the other, or even complications have set in. For instance, I once saw a patient in the clinic who was having erectile dysfunction. He was having problem with his erection, and that was why he presented to the clinic that day. But unfortunately, that was the first day we were coming to know that that man has been diabetic. When we did a test, glycated hemoglobin, that will show us what the sugar control has been for the past 3 months, we noticed it was quite high. So make regular checkup your thing, your make it part of your routine. Okay, have this discussion with your healthcare provider. Have a timetable on how regular you're supposed to visit the clinic for your checkups, depending on your age. Okay, chronic illnesses, like I've talked about in my previous videos, hypertension, diabetes, and cancers, when they come, sometimes they have come to stay. So you just have to make it a habit to attend regular checkups. Make your appointments with your GP or your doctor something that you look up to, and something that you are not nonchalant about. Don't give it this laissez-faire attitude. I'm not feeling, I'm not having any lightheadedness, I'm not having any headache, I'm not having any fever, so no need going to the hospital. Please check your numbers. Know what your blood pressure is, know what your blood sugar is, know what your baselines are for your blood workups, know what they are. Okay, know what your values are on a very good day, so that when they start rising, it becomes easy for someone to say, last time you came to the clinic, it was this, and now it's beginning to be this, so most likely it's beginning to rise, and adequate measures can be put in place on time to help you take care of these things. I want to tell us that you see, staying healthy, in as much as your healthcare provider has a role to play, you also as the individual has a role to play also. So look out for this page for more tips and more teachings on how you can actually go about your health matters. If you're just coming across this video for the first time, please hit that like button for me, hit that follow button for me, and share this video. So thank you for staying tuned today. I'll see you some other time. Bye.